Good morning.
Good morning. How you doing?
Doing great, Mom. All right, so welcome to From Our Family to Yours Medicare Talk.
Where we bring you real talk and real care because your health matters.
We're a mother-daughter team and the heart behind Health Matters Insurance.
And we're here to help you thrive with your finances, your health, and your life.
Every week, we'll break down Medicare in simple terms, answer your questions, and share tips to help you make smart, confident decisions.
Whether you're enrolling for the first time or helping a loved one, you're in the right place, and we're so glad you're here.
Let's dive in. And today we have a special guest. We'll go ahead and bring her in. We'll have 4 generations at the office.
Today, this is exciting.
Robin.
Oh, you gotta show her.
Uh-huh.
Come on in, Mama.
Come on, Robin. We'll do all 4 of
Squeeze.
these. She's being good.
She's fine.
Hello.
Okay, and here's Ramen getting bigger. She's such a good girl.
4 generations.
Yeah, but the one's a dog.
Alrighty, so we're going to start with the heart opener.
Yeah.
What was the quote you had this week?
So for this week, the quote is, "The first wealth is health," and that ties into everything that we do. I think we can all agree that your health is so important.
Yes.
And who said that?
Waldo Emerson. Ralph Waldo Emerson.
Okay, so the first
First
wealth is health. And it's so true. That's why we named it Health Matters. If you're not feeling good, what's the point of being alive? I mean,
Amen to that one.
Alrighty, so
Yeah, so today, we have Grandma in, and she is our client, so she can share her real life experience with Medicare and her plan. So this week in the office, we had an executive come in from United Healthcare, and we know there's been a lot of things in the media, a lot is out there right now, but all we can speak about is our experiences that our clients have, and then Grandma will talk about firsthand her experience with United Healthcare.
Yeah, it was great. Yeah, well, anyway, I went to Vegas with my children. I was there one day. One day. We walked on Fairmount Street. I gambled a little, not much. I walked on Fairmount Street. Got tired, and you know.
well, you had done 15,000 steps that day.
That's right, and that's a lot.
And it was like 9:30 at night, 10
Right.
o'clock.
So me and Tabitha, one of the girls, not my daughter, a very good friend, went upstairs to the room. She went to bed, and I went to bed too. And then I couldn't breathe. I mean, I could not breathe. So do I say all that?
Yeah.
About the hotel and all that?
Why not? Tell your
Just
story,
say-
yeah.
You can say
Oh
whatever you
my
want.
God! So Tabby was a nervous wreck. So she calls down at the, desk, and they supposedly sent up whatever they sent up, paramedics, but they weren't. They had no oxygen in the tank.
I didn't know that.
Oh yeah.
They put the
Oh.
mask on her, and then she
Yeah.
couldn't really breathe because there was no oxygen.
Right. I could breathe a little bit, but not like a normal person,
Mm-hmm.
So then they called the ambulance finally. Well, they were kind of woo-hoo. So anyway, they did take me to United. No, what was it called?
University?
Community University Hospital. They were wonderful, absolutely wonderful. And then I had open heart surgery because I couldn't breathe, so they had to do something. And I was there 2 weeks in the hospital, and my poor daughters.
Honey, it was 3 weeks.
Oh, well, I didn't remember. Hell, I was out. But anyway, my doctor, Giovanni, I can't remember his last name. Isn't that terrible? Anyway, he was wonderful. Where do I show this?
Right up there.
Yeah, you can stand up and here, hold it closer.
Oh my
This is
God,
her doctor.
I loved him. He was the sweetest man.
We can tell by that smile.
Oh
It
yeah.
kept her spirits high.
Yes, he did. Oh my God. Anyway, I had great care at that hospital. Well, then, when I get home, naturally I get a bill, okay? And it about freaked me out because it was over $400,000. United Healthcare paid they paid almost all of it. I can't remember now what I had to pay. What I had to pay, that scared me.
Hello.
Anyway, I paid it off. It wasn't that much. I sent $100 a month.
You had the maximum. You
I
had the
have
maximum.
United Healthcare Advantage,
Yes.
Yeah.
and it excellent.
Did you have any problems with anything?
No,
Have you? You've been on the plan for how many years now? About
2 years?
maybe more.
No,
than
2.5 years, because your heart attack was 2 summers ago.
No, it was in 2023.
Okay.
So
So then,
it's 2025. Oh, that is 2 years.
yeah,
ago.
but it was during the annual enrollment period in 2022 when you switched, because you were only on the plan. I'm just.
so it's about
Right.
For like
it's
6
about
months.
3 years she's been on the plan.
Yeah.
Well,
So-
anyway, I really like it. Okay, I'll shut up.
No, you're
No.
fine. So
Yeah.
anyway, during that 3 years, have you had any problems with United Healthcare?
No, the only problem I had was that one gal she didn't have all the numbers down right. I tell you, some of these people in doctor's offices, ooh.
And
Yeah.
exactly, I think sometimes something will happen at a doctor's office or a pharmacy and they think it's United Healthcare's fault.
It's
but
not.
With that example, that's at the doctor's office. She didn't have your member ID right.
Yeah,
So then
she
when
kept
things.
telling me I didn't have insurance. I said, yes, I do.
Yeah.
Yeah, but we got it straightened out, and, she was having a bad day. So,
Yeah.
Well, she was.
Well, it's good
and
that you-
happens. And so when I was with Mom when the heart attack happened, I was with her in the ambulance. I was with her in the hospital for the 3 weeks, and I, as an agent and an agency owner, I just thought that I was going to have to do something to help get the bills paid or get her the care that she deserved or anything
Yeah.
that she needed. But I didn't. I didn't have to fight or say one thing about anything. Everything was taken care of. She came home. She did go to St. Luke's for a week. She did cardiac rehab at St. Luke's. Everything was covered. She did hit her maximum out of pocket of $2,800.
Hell yeah.
But we had a hospital indemnity plan, so it covered most of those expenses.
Yes, it did.
She got
Yes,
it. You
it
got a
did.
check once
And
we
all
submitted.
because of my granddaughter talked me into it. I went with her, not my daughter. Isn't that funny?
She wouldn't let me write her plan, but after Paige started doing it, she said, okay, I think you need clients. So that,
No, that's not what happened. I was.
Yeah, it was.
Well, I was over there and I answered a phone call from a client, and then you said, "Okay, you kind of sound like you know what you're doing now. Do you want to review my plan?" And so you were with Grandpa's old insurance,
Right, so, yes, I
a
was.
retiree plan. So,
Right.
and she,
And I was paying a lot of money.
yeah,
This time I'm not. So
you were paying like $330 a month,
$300 a month.
$300 a month.
Yeah.
Okay.
That's pretty good.
and it was a transition because you were used to not really having any bills when you went to the doctor. So that was a little bit of a change because on the Medicare Advantage plan, you're not paying anything per month, but you do have copays and you will get bills sometimes.
And
for
I do
things.
my co-pays are $25 a
For the
visit.
specialist.
Well,
Yeah.
if you think about it, that ain't.
No, that's not bad.
Yeah.
Right. So she's saving the $300 a month, and Paige put her on the Medicare Advantage plan, but then she also put the hospital indemnity plan on top. But
Mhm.
I had to double check because I knew what they were going to try to do. Because I said, if you're switching her off of that plan, you got to give her the protection like she has that plan. And they did the hospital indemnity plan for 3 days in the hospital?
Yeah, so, and this is a really good point, because when we sit down with people, they're like, I don't want to spend extra money. If I'm getting off of this plan where I'm spending money and now I'm getting on a $0 plan, why do I still want a premium? But thankfully, we went back and I did increase the amounts and everything, because remember, we're like, oh, we'll just cover 3 days in the hospital at like $300, and then we'll just cover this, because we want to keep your premium around $60 or $70 a month. We don't want it to be any higher. But then whenever you found out, you're like, no, up it, we need better coverage, and thankfully we did, because
Well, I don't know what it is now. Should I say what I pay?
What do you pay?
$83 a month and some change. I can't remember. the
Okay, yeah.
change.
So, and that's 100, if she's in the hospital for 8 days, she's going to get $350 a day. So she's going to take that money, or she's supposed to take that money and pay
the hospital
the
bill.
hospital bill.
Yeah.
I don't remember getting $300 a day.
You got more than that. Remember you got that big check in the mail from Heartland? How much?
Oh, hell no, I don't remember anything. That's 2 years ago or more.
Okay.
It happened.
But, you know, she was well taken care of, and
Very well taken care of.
I would not put my mother in a plan that I didn't agree with or think that she was going to get good coverage.
That's correct.
So she's been with United for 3 years now. I know there's a lot of bad press out there.
Oh my God, that poor man that got killed.
Right, and then
Oh.
just every day you're hearing something about United Healthcare denying coverage and, you know, not paying claims and whatnot. And I just tell my clients what I've seen. I've been doing this for about 9 years now, and I have a lot of clients on United Healthcare, and not one of them have ever had a problem that couldn't be taken care of. So, you know, we can't always believe what we hear on the news, as we know that with many, many things. So, you know, it's important to use a local agent. We do this every day. You know, we know the plans, we know the networks, we know what's good, what's not good. So, and all of our services are free. So if, you know, you don't use Health Matters Insurance for your insurance needs, use somebody local.
Mm-hmm. And I don't even think we mentioned that we're here in St. Louis, and she was out in Las Vegas. So there's a national network with United Healthcare plans. I mean, it was an emergency, so you're covered under your Medicare Advantage plans or a supplement, but it really depends on the company you're with, because they could fight the claims. It could be a little bit harder to get paid, but you saw that there was no issue. They
No
took the
issue
insurance.
whatsoever.
Yeah.
And
No.
being as it was an emergency, you know, we just called the ambulance. They took her to the closest hospital, and it was covered at 100%, you know, with her co-pays because it was an emergency. But again, like you said, United Healthcare does have a national Medicare network. So while I was sitting there for 3 weeks, you know, I'm looking up doctors and hospitals and seeing who's in network and who's not. Her surgeon was in network with United Healthcare, and so was the hospital. So, you know, which is very nice. But we just, you know, kind of wanted to come on here and just give the story of Mom, because she's a real person. This really happened.
Yes, I am.
And, you know, we've experienced it, and we didn't have any problems at all.
No, I did not.
Which
It was
was
very nice, very nice.
She took a lick.
Even though they're my children, well, granddaughter and daughter, that wouldn't matter. They will help anybody that has United Healthcare through them.
Or any of them. So when we first started, we were just with United Healthcare, but we became brokers over 3 years ago, and now we can do any of the other plans too. We just have really good
Do
experience
you
with
do
United.
Aetna?
Yeah.
Something's not right with that.
But there's probably something in the news, in the media.
What
But
did you hear about it? No.
I can't remember. I'm
it's
not
something
saying
with the
anything.
pharmacies and their PBMs and stuff like
Oh,
that.
okay.
But there's
So-
something going on. But there's something going on with a lot of companies. Humana, you know, Cigna, there's always something going on, but you want to work with people that do this every day so they can tell you the facts instead of all the fluff that's online.
No,
Yeah.
and while we're here, I just do want to mention AEP, annual enrollment period's October 15th through December 7th. I'm already getting calls, everybody saying, what's the new plans? What's going on? Blah, blah, blah. I need to hear. And I tell them, I cannot legally speak to you about it until October 1st. I know some of the telemarketers will call you and tell you
Oh, my
all the
God.
plans.
Are we gonna do that about telemarketers?
Yeah.
They make me puke. I'm so sick of them. I tell you what,
Yeah.
and you all know what I'm talking about. It is bullshit. All these phone calls, I can't understand half of them. But anyway, it is ridiculous.
It is
Absolutely.
ridiculous. One way you can call the Attorney General and you know report the
yeah,
numbers.
you'll never get through. Go ahead, try.
And you can always, you know, put the spam blockers on your phone and, you know, try to prevent it. I don't answer my phone if I don't recognize the phone number.
I try not to, but you know how that goes. Phone rings, you think it's somebody you know or one of your kids. So
Right.
you answer it.
Right.
But
So-
you're really good. I mean, obviously, you know, you never give over your Medicare number
Oh,
over the
hell,
phone.
don't ever
You're-
do that.
Yeah. So
Don't
there's just, you
ever
just have to
give
protect
any
yourself.
numbers, Medicare numbers, Social Security number, never to anybody.
Right.
Oh my Lord.
So, yeah, I mean, the biggest thing is don't give your Medicare number, or, like you said, or your social. And they don't, you know, you don't even know where the people are located. You're never going to be able to probably call them again. So it's best to work with somebody local.
Mhm.
Okay.
Alrighty, anything else did we want to talk about? I thought we were going to do a little segment, you know, through the eyes of an 80-year-old, which could be another
I'll be
episode.
81 tomorrow.
Birthday's coming up tomorrow. We got a birthday weekend extravaganza.
We're starting
planned.
with the birthday lunch today.
Yes, we are. We're going to the Irish pub, which I love. Okay.
Anything else you want to talk about?
Well, I don't think I should.
What is it? What about?
Oh, I don't know. What are you gonna say?
What about them? You can say it. It's a free country. You can say whatever you
True.
want.
Well, they send out too damn much mail, and they always want money, money, money.
Yeah.
I'm tired of it.
Okay. So,
I do support AARP, but not every month. Come on, guys. We're not rich. I live on Social Security.
yeah, quit. So you say AARP.
I thought it was going to be
too much
way worse than
information.
that. Oh, that's not bad at all.
Well,
I didn't know
I
where
don't
you're
think
going.
you should say something about a company like that. But really, come on, guys. You all know what I'm talking about.
Yeah.
Every month. Sometimes I get twice a month. Not mailers, honey. They're prepaid, not prepaid. You got to put a freaking stamp, and now the stamps are what, 55 cents a piece or something?
No, they're like 70 something, aren't they?
Good God, I hope not. I mail all my bills in. One of my other daughters, Debbie's going to try to teach me how to do it. I have a tablet my granddaughter bought me, and I've got to learn how to do that. But it's so aggravating.
Well, we're also, you agreed to getting a smartphone too.
No, I did not.
What?
I have
Hello? You don't have memory issues. Don't even try to go there.
No,
You
no,
said.
no. I have a consumer cellular flip phone, and I love it. I know how to work it. I am not fooling with all this technology.
I thought you said
Most
if
of you guys out there do it. You're smarter than I am.
I thought you said if you consumer cellular had a smartphone, you would do it.
I said maybe. I never said yes.
Okay, we got a maybe.
And for the record, the postage stamps now are 78 cents a piece.
Wow.
Good Lord. That's $78.
If you get 100,
Yeah, because I buy a roll at a time.
right? Yes. They
Oh, that's another thing, the freaking post office. Oh my God. Some days I get mail, some days I don't. My mail's late. I owe Ameren, the electric company, for 2 months. I didn't get a bill last month. So how am I supposed to know? Oh, I'm just sick of a lot of stuff.
Grandma's so positive, but we're here to talk about some
I'm
of the
so
issues.
positive.
You are.
A lot of times.
Don't get it confused. You're
Well,
a positive
it's okay,
person.
I'm a happy person normally. I really am.
Yeah.
And I'm usually positive. But there's so much going on in the United States that is bull.
Yeah.
Okay, we're going to be a third world country soon.
Well, let's hope not.
Yeah.
I hope not is right. Oh, and there's my great granddaughter. Hi. She's learning not to bite. You can't let them bite.
No.
She's a good girl. She's
Okay.
getting big
Just a
fast.
puppy.
Alrighty. Anything else?
I think that's it. It's good that you shared your story.
What about the joke of the week?
Oh, yeah, let's do it.
Alrighty.
Oh, this is a good one.
You're not supposed to. You're supposed to act like you haven't heard it yet.
But they didn't give me the answer
Okay. Why is Cinderella not good at soccer?
because she lost her shoe.
Oh, okay. No, because she keeps running away from the ball.
Isn't that fun?
Alrighty. Well, we are glad you guys tuned in today, and we just hope you have a fabulous day.
Right. Nice talking to you.
Bye.
See, that's easy peasy.
That was fun.